Now they're like vacuum packed coffee cans, right? Their liver actually hangs lower than their rib cage, and their spleen is much more susceptible to injuries in kids for blunt force trauma. Their rib cages are much more flexible, so they can take much more of an impact. So when we're compressing or doing compressions and ventilations on a baby, what's the compression ventilation ratio? 30 compressions and 2 ventilations. What's the speed I'm going to go at? 100 beats a minute. How fast? 100, yes, very good. So 100 beats a minute, again, is our staying alive type song, right? At least 100 beats a minute. How many cycles? 5. How deep do I squeeze the chest? So 1/3 to 1/2 the depth of the chest. Well, let's have a look at that. There's anterior, posterior chest. So let's take that and take half of that. How far is that? Good 2 inches, right? So it's a good 2 inches. So we want to really make sure we get some good depth in there. So 1/3 to 1/2 the depth of the chest is how deep we want to squeeze the chest. We used to do 1/2 inch to 1 inch, but it wasn't deep enough. Remember, the heart is the size of that little kid's fist. Little tiny thing. So we want to be landmarked appropriately. So how do we landmark for a baby? There's an imaginary line that actually runs between the nipples. We can use that on babies. That imaginary line runs across to the center part of the chest. These 2 fingers are laid down directly in line with that nipple line. We lift up our index finger, so we're 1 finger width below the nipple line, and that's, in sign language, we call this what? I love you. So this is the little I love you baby position, right? So across the center part of the chest, lift up. Your wrist is locked. I see a lot of people do compressions like this. That's wrist given out. You got to keep your fingers locked directly over the top. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. How fast is that?
100 beats a minute.
100 beats a minute, right? So you're going to do 30 compressions, and then we're going to ventilate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4. And you're going to continue doing that for how many cycles? 5 cycles, right? So push here, blow here, push here, blow here. That's all we've been teaching you all morning, right? If you're pushing here and blowing here, you're doing some good. If you're pushing there and blowing there, stop. Change it around, push, blow, right? Make sense? So let's take it from the beginning. When do you usually find babies in cardiac arrest? What's the #1 cause of cardiac arrest in babies?
Lack of oxygen.
Lack of oxygen causing, so suffocation, sure, absolutely. What else?
Drowning.
Drowning, yeah. Choking, yeah. What else have we got? Dehydration later on, excessive amounts of fluid loss can cause cardiac arrest, sure. But like Gerald said before, the #1 cause of cardiac arrest in kids is respiratory in nature. They don't die because of too much beer and pizza plugging up their arteries, right, like they do in adults. It's probably because they've been suffocation, drowning, drug overdose, poisoning, pills, whatever. Then something goes into the mouth, kid chokes, eats pills, whatever. It's respiratory in nature is the majority of the times babies go into cardiac arrest. Yes, there's illnesses, there's medical conditions that can, there's other exceptions to the rule, but the majority of the time it's respiratory, right? Take care of the respiratory problem and you'll help take care of the cardiac arrest situation, hopefully. The likelihood of you getting a pulse back in a baby is very minimal difference between that and an adult anyway. So the principles are exactly the same. I come into the scene, baby, wake up. Make sure our scene is safe, take charge, call help, check the air for hazards, make it safe. Mechanism of injury, what happened and how many patients am I dealing with here? Rubber gloves are on, I can come up, tap and shout, baby, wake up, no response. What would I get the wife to do? Honey, call the ambulance again. Baby's had it, right? So call 911, hang up last, get right back. Can I use the defibrillator on a baby? No. Unless it's a pediatric, it's got a pediatric dose attenuator, which is this little bar that goes in between the pads that actually are on the leads, that actually drops the resistance from an adult machine to a pediatric setting, and then you can put the pads on front and back so they're not touching. Usually it's only done with paramedics. We go with pediatric settings. you guys don't usually have a pediatric setting on your defibrillators. The most common things you guys have is adults, the adult pads. You don't even have pediatric pads in yours in this industry anyway. But you can run codes on babies as well. So I've tap and shout. Next thing I want to check for is what? I've sent for an ambulance. Next thing is check circulation. Also looking for coughing, breathing, movement, right? I'm looking for skin condition, color, temperature, all that kind of stuff, not just feeling for a pulse. There's no pulse. What do I do now? Start CPR. Landmark, draw across the center part of the chest. How deep am I going to squeeze the chest?
2 inches.
Third to the half of the depth of the chest. Compressions to ventilations.
32.
How many beats a minute am I aiming for?
100.
100 beats a minute. How many cycles? 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3. See how fast it's going to get right on there? If that's 1 cycle, 2 cycles, you do that for 5 times. Right? Any questions with that?
You understand, for those who've taken CPR courses over the years, keep in mind this is simpler now. Remember how you used to do it, an adult would be one rate, and you know, a certain ratio, and a child would be another, and a baby would be another? This is all the same. 30 to 2, about 2 inches, rate of 100. So you don't have to memorize which one is which, it's all the same system.
Quick and easy, right? All right, so everybody got a baby?